In this video, we'll talk about what is the direct and indirect transmission of the infection. Direct is called when there is a direct transfer of the pathogen from the infected patient to the dentist or the operator. For example, in the past, when the dentists were not using the gloves, so if we have injury on your skin or breakage of the mucosal barrier, then the pathogens can be transferred directly into the bloodstream of the dentist. So this is called the direct transfer of the infection. The other examples are the needle stick injuries. When we have a needle stick injury, the blood of the patient directly goes into the bloodstream of the dentist. In a similar way, another example is the when you are doing a procedure like scaling or root canal treatment, and there is droplet of the infected individual having their blood. So the pathogen can be directly transferred from the infected individual into the eyes or mucosa of the dentist. These are the example of the direct transmission of the infection. So what is the indirect? In the indirect transmission, as the word shows, that there is some indirect mean by which the infection is transferred. For example, the dentist is touching the handle of the light or touching the triple syringe. Then these surfaces will be contaminated by the blood of the infected individual. And when the next patient come in, even you change the gloves, when with the new gloves you touch the light handle or triple syringe, your gloves can become contaminated again by the blood of the previous patient. So that's how you transfer the infection indirectly in between the patient. Or the other example, if there is a infected patient, for example, he has tuberculosis, so when he breathes, the air can get contaminated, and when the next patient come in and he breathe the same air, then the infection can go into the respiratory system of the next patient. So in order to avoid the indirect transmission of the infection, there are many protocols. For example, there have to be a negative suction or high volume suction present in the operatory, or you use the barrier technique. In the barrier technique, when you put the barrier on the triple syringe, you put the barrier on the light handle, then you stop the transmission of the infection in between the patient. And you have to understand the different protocols for the transmission and to break the chain of transmission of infection by the indirect means.